Asia's first conference on advanced care planning has begun, bringing together experts from all over the world to discuss the subject and share best practices. And for more, we're joined by Tan Kwang Cheak. He's CEO of the Agency for Integrated Care, which is organising the event, and Dr Adeline Lam. She's co-lead for the Advanced Care Planning Initiative at Tan Tock Seng Hospital.
Well, let's start with you, Mr. Tan. Putting this in layman's terms, essentially advanced care planning is using the mental capacity that we have now to look into the future for when, as in most cases, if you live long enough, you will lack that capacity. So now make the decisions so that when you do not have that capacity, you can live your life as you would choose to live it now, being able to think about it. But when you have that conversation with patients or people thinking about it, it's a difficult conversation, is it not?
Yes, indeed. Thank you so much for having me. And you're absolutely right. I think the conversation around advanced care planning and being able to express our values, beliefs, and preferences in terms of the care that we would like to have at the end of our life, particularly when we lose the mental capacity to do so, is really important. But we acknowledge that it is not an easy conversation to have, which is why we have been working really hard on advanced care planning service to actually enable and also encourage our Singaporeans to come forward to have that conversation based on a structured, facilitated process, and also record down their values and care preferences so that their nominated spokesperson actually is able to know that and able to make the right decision based on their preferences when they are unable to do so. I think the good thing is that over the years, we do see greater awareness of Singaporeans being more open and being more willing to actually talk about advanced care planning and what they would like in terms of their care towards the end of their life. We do also see more Singaporeans coming forward as well to do their advanced care plans together with their nominated health spokesperson. So now, currently, we have over 35,000 Singaporeans which have completed their advanced care plan. Of course, there's a lot more that we need to do. Our hope is actually for all Singaporeans to be able to have this advanced care plan and have that conversation with their loved ones and their family, particularly when they're healthy, so that their preferences, what they would value as the quality of life, at the end of our lives will actually be respected and recorded. This also helps to ease the burden and the stress on the family and the loved ones when they have to make certain care decisions at the end of the life for that person, particularly when they can't do so.
Dr. Lam, let's bring you in on the conversation here. I mean, it seems to me from what Mr. Tan is saying, ACP is a very important and perhaps a routine part of what your health planning should be like. Anybody, regardless of one's medical condition, what your state of health may be at any one time. And you're dealing with that a great deal at Tan Tock Seng. What's some of the feedback that you get, though, from patients when they begin this conversation about ACP?
Thank you for that question, Dawn. So I am a doctor at Tan Tock Seng Hospital. I'm also an ACP facilitator, so I can see both sides of the coin. And most of the time when I offer this conversation, it is well accepted, I would say most of the time. And the reason is because ACP is really a conversation about living well. It's not about death, it's about living well. And so when done well, it can be well accepted, and it is a very good conversation. So most of the time, when the facilitator is in that conversation, the facilitator becomes a mediator and navigates through the sometimes difficult conversation, and it's very useful. So maybe I can share with you an example. So in my clinic, I have a patient with many family members. So I offered her advanced care planning, and in she came with her 10 family members, children and in-laws, and they were all very interested in what she had to say. So when I was doing the ACP conversation, when I picked at them, they were really focused on what mom was saying, what mom was sharing. It was a way to hear what mom has to say, but not directly, because it's sometimes a little bit difficult for family to talk about this, but with a facilitator, it gets a little bit easier.
All right, I don't know who will pick up this question. I'll ask it first and then you decide, okay?
Sure.
Advanced medical directive that is something that comes into play usually when a patient is critically ill. So you make a choice. How much resuscitation do you want to carry out or not carry out? But with advanced care planning, it's not an immediate choice. The person could be long-term palliative care, not seriously impending fatality. What is the difference between the two? And with AMD, it's more straightforward, resuscitate or not. In this case, the decisions are over a long period of time. People change, people's feelings change. With long-term illness, you can change your view on death.
Absolutely.
Have they considered that when they have these good conversations with you? Okay, I'm sorry, Dr. Lam, take this first.
Shall I take this question? Yeah. Okay, so with AMD, that's a legal document, and it's only valid when your life is critically ill, there's no reversibility, then it takes place. It can be activated. Whereas advanced care planning is useful throughout your whole life. You can review it at any point. As you said, things change. I can have a child, I can develop a new condition. Things change, and you can always review that advanced care plan and keep changing it. So it's basically a series of conversations you have throughout your whole life, and it's a process of future healthcare plan. You can decide at this point in time, and later on, when things change in your life, you review it and you change it again.
Right. So Kwang Cheak, do you find that when individuals, I mean, you mentioned that there are 35,000 who've signed up for this, do they tend to have lasting power of attorney and an ACP sort of plan as well?
Indeed so, and we see more Singaporeans focusing and being open to actually look at end-of-life planning, and that actually includes both lasting power of attorney, as you mentioned, as well as advanced care planning. The lasting power of attorney actually is a legally binding document that grants the donee that's been nominated the legal power to act on behalf of the person. And the ACP complements that. It's not a legally binding document. It is a conversation, as Dr. Lam mentioned, with a facilitator based on values and what we would prefer as our care. But it complements then the LPA, because LPA grants a legal right for the donee to act on behalf of the person. But ACP then articulates quite clearly the values and the care preferences of that person that would then help both the spokesperson, but also the doctor or the healthcare team in charge to be able to make the right care decisions for the person when the person is no longer able to do so. So both are actually complementary tools that we would encourage in terms of end-of-life planning. In fact, AIC, together with the Ministry of Health and Ministry of Social and Family Development, we are working together to look at how do we promote both LPA and ACP and encourage end-of-life planning for Singaporeans. And we are actually putting in joint efforts to do so.
Well, important conversations about empowering people to know what kind of choices they can make in their lifetime. Thank you both for sharing this with us. We've been speaking there to Tan Kwang Cheak from the Agency for Integrated Care and Dr. Adeline Lam from the Tan Tock Seng Hospital. Thank you.
Thank you.
Thank you.